For 20 years, we've committed to helping the people of the Cayman Islands live longer, healthier, and happier lives. But healthcare and the expectations of patients are rapidly evolving, and so must we. We have made incredible clinical and technological advancements and achieved JCI accreditation, the internationally recognized gold seal of approval for patient safety and quality of care. So it's time for our image to reflect our transformation from a local hospital to a world-class healthcare authority with a new logo that symbolizes national duty and pride, a statement that reinforces our commitment to our patients every step of the way, with colors as bold as our mission to provide the highest quality healthcare. Dynamic, professional, skilled, committed, caring. This is HSA.
All right, folks, we're here with the Health Services Authority and their expanding orthopedic group. So pleased to have 2 out of the 3 orthopedic surgeons sitting down with us today to chat a little bit. Let's go ahead and do some introductions. We'll start off with you, sir. Let us have your proper title and, where you're from.
Okay. I thank you for the opportunity of speaking to the Caymanian public and the people at large. My name is Dr. Andrew Bogle. I'm an orthopedic spine surgeon, and I actually trained in Jamaica. I trained at University of the West Indies and went on to do my further postgraduate training at University of the West Indies. And subsequent to that, I went to do fellowship training at the University of Manitoba and University of Calgary in Canada. And that's where I did my further subspecialization in spine surgery.
Very interesting. All right, spine surgery. Doc, how about you?
Dr. Larsen. Well, I'm Danish. I can't say that I'm not. I did my training in Denmark. I did my fellowship in England, in Liverpool and Broadway University Hospitals, where I did some of my research within cartilage. I went back after my fellowship and was head of the cartilage and research division and transplantation team in Denmark. So I got a keen interest in cartilage and within sports traumatology. So I'm a sports traumatologist, but do hand, knee, foot, ankle surgery. But my keen interest is in sports traumatology. I've been doing orthopedic surgery for 30 years.
Right. Very, very fascinating. So how long have the 2 of you been at the Health Services Authority?
Well, I am actually the newest member to the addition to the orthopedic team. I have been here for close to 6 weeks now.
Okay.
And so it's a part of the wider vision to actually improve and enhance the orthopedic offering of the orthopedic fraternity here at the HSA.
So beautiful. All right. And you've been here?
I've been here 4 years.
4 years. Okay. Yes. Wonderful.
But now finally we got 2 newcomers. We got Bogle and we got Alvin.
You must be excited.
Which is super great. We're really looking forward to have expanded our services within HSA with those 2 guys.
Right. So when people hear the term orthopedic, what should they think about in layman's terms? What does that mean?
So orthopedics is the management of musculoskeletal pathology and musculoskeletal disease that affects our patients. And in layman's term, a lot of persons think that orthopedics is just a bone and joint doctor, but it's a lot more than that. We look at the whole soft tissues, which is the skin, the muscles, the nerves, and the tendons, along with the joints, along with the spine. So we looked after the entire musculoskeletal system of our patients. And in terms of, I know you'd be interested in what type of patients may need to see the orthopedic surgeon. And we don't only wait until our patients are sick, because part of healthcare is being preventative, being proactive. So we're all about health education and also about health treatment of our patients. So we see the whole gamut. We see from the children along all the way up to the elderly patients. And we see you have your patients where you'll have your congenital deformities. That is, they're born with their pathology for whatever reason. And then you have those patients who develop the abnormalities. And then you have the big subset of trauma and traumatology who will see and will address those patients also.
Good. All right, so let's get into a little bit of the details then of what different specialty areas are included in the overall, umbrella, if you will, of orthopedics. So, let's run through the list. We've got foot and ankle. I think people often forget and neglect those particular areas. I always say that carries the weight of who we are every single day. So how many, patients do you see with like feet related, ankle related issues?
Well, what we do see is that any patient who comes in through A&E, if they have a fracture, well, we'll have to see if we can treat it conservatively, if it needs surgery. If it's a sprain, normally we would see them in our outpatient clinic. Very often we do MRI scans to figure out, is there any ligament tears, is there any cartilage defects, is there any issue which needs to be dealt with. We have a close cooperation with our physiotherapists who then look after the patient if they need surgery, if they need anything. Well, then we take care of it as our outpatient. But it's the normal production is it goes through A&E, is seen by us either in A&E if it's a severe case, otherwise it's referred to us in our outpatient clinic.
Right. I feel that probably feet and ankle issues are probably fairly common in the world of orthopedics. Would that be a fair statement to make?
It is, and thank God we got 2 of those, so we see a lot of those.
Very good. All right. How about hand and wrists? Oh my goodness. So we're on, computers all day now. There's a lot of lifestyle things that we do on our smartphones. All these things impact the usage of the fingers and the wrists and the hands. Tell us what observations you've made specific to people coming in with hand and wrist related injuries.
We see tons of overuse injuries.
Yeah.
I used to be head of our research division at the university in Denmark where I came from, and we did a study just before I left where we had 16-year-olds who are using their phones. They now have degenerative changes like a 70-year-old to some of their joints due to simply they're using their phones all the time.
Yes. Yeah. So that repetitive action can be very, very detrimental.
Which is the same with people on computers. They get any kind of tendinitis, ligament injuries, and so on. Which we treat mostly conservative, but still it needs treatment as well.
Right. Okay. All right. And then we've got cartilage repair. So we talk about sports injuries as well as repetitive use injuries as well.
Yeah. Both Alvin and I are sports traumatologists. So we in the sports clinic where we are now at Smith Road, we're going to see, or we already see, a lot of patients with overuse injuries, any kind of injury doing football or whatever they've been doing, with some kind of surgery, any ACL reconstructions, cartilage defects, and whatever.
Yes. So for the sports-related injuries, what would be your best recommendation? If someone, we've got people who are young athletes and perhaps they haven't really been shown how to properly warm up and cool down. How significant are those things when it comes to injury prevention?
Well, it's known that if you don't do any kind of warm up, if you don't do anything of cooling down afterwards, well, you will be able to prevent some of the injuries that you would see if it does have a sudden impact to your ligaments, your muscles, and your tendons. So normally, any kind of warm up, any kind of cooling down period is essential.
Yeah.
So.
And then you've got people like myself, you kind of get to that middle age and you fancy you're still about 25, 30 when you're really not.
22, but I didn't bring my glasses.
Yes. And, I want to jump back on the pickleball court. I should ease into it is what you're
You should
pretty
definitely
much
ease
saying.
into it. Otherwise, you'll be sitting next to us with an Achilles tendon rupture quite soon.
Exactly. All right. Very good. And then hip replacement and reconstruction. That I think is extremely popular. I remember a few years ago I saw a surgeon in Miami and he was saying to me that probably about 30, 40 years ago, he's like, we didn't see quite as many people needing knee replacement and hip replacement surgeries. Now it's extremely common. And not only is it common, but the age, like it was sort of an older person was a typical patient. Now you see, because people are sort of overusing their hips and knees and so on, that the age is dropping a little bit. Are those your findings?
Most likely it's not. Well, Alvin, who is just standing next to you, who's next in line, he could probably give a better answer. But what it is actually the demand. So if you look at it historically, it was elderly people who got a hip and a knee replacement.
Right.
Now the demand and people's quality of life has changed. So what they actually expect is to be active in a total different
see.
level than what they were earlier. So
Right.
people don't accept to be in pain. They don't accept to be reduced in their activity. So
Yes.
the age for giving hip replacement, knee replacements has reduced. And
Okay.
which is not a bad idea, because
Yes.
it's much easier giving a 60 or 65-year-old a new hip or a knee replacement than an 85-year-old. There's a lot of comorbidities which has to be put in place.
Right.
Yeah, just to add a little more to that,
Yes.
it's twofold why there's been an increase in the numbers of patients. Is one, the science has actually improved in terms of the whole. There's a lot of research being put into it, the type of materials being used in our patients, the longevity of the implants that have been used. So there's a lot of science being put into it. But similar, just to highlighting what Dr. Larson said, is that the demands of our patients and the activity of our patients is also improved, because we have a lot more patients who are, our elderly population is still active.
Right.
Gone are the days where you had to retire at 50s, 60s, you're still active. That is the new normal now. So our patients still expect a certain quality of life, and we're here to give it to them, where we can give them a pain-free and active quality of life.
Very good. I like it. All right. And orthopedic trauma, another specialty area that you guys might actually see patients. What sort of trauma? Mostly sports related, or if you get in a car accident, that might be another example.
It'll
of
be
where-
anything from
Yeah,
having
slip
a
and
fall in your
fall.
house.
Yeah.
You could be elderly having a fall in your house, having a hip fracture. It could be traffic accidents, sports injuries, whatever comes into A&E.
Okay. Right down to pediatric orthopedic surgery, so even babies and young children.
Yeah.
Do you have to wait to a certain age to correct certain types of pediatric related, if it's like some sort of a defect that they're born with? Do you tend to wait to kind of see, or what's the leading sort of medical advice these days for parents?
It depends on
depends.
on what kind of disease. Some diseases has to be corrected immediately. Some will have to wait. So.
Yes. Okay. So come in, speak to the experts, and they'll evaluate on a case-by-case basis exactly what needs to be done.
Definitely.
Yeah. So this is super exciting. We've got lots of other things, and we'll be talking to Dr. Almeida here in just a little bit. But, this is amazing that your sports medicine team, your orthopedics team continues to grow. So, folks, these are two of the experts that you can see as part of the growing orthopedics team here at Health Services Authority. Thank you both so much. We're going to now speak to Dr. Almeida and get some tidbits from him as well. All right, so we're going to talk about spinal surgery as well. Now, most times when people think about the spine, they think, oh my gosh, that's the one thing that I don't want to touch. I remember back in the day, you had good advice like, oh, you had scoliosis, just leave it alone. Don't touch it, because you might walk out worse than you were. Tell us a little bit, Dr. Bogle, about, your specialty is obviously spinal surgery. Where are we at now in the world of surgery when it comes to that? How efficient can procedures be? And what quality of life do your patients expect after surgery?
Okay, thank you so much for that question. I liked how you highlighted it before, because previously everybody used to think that spine surgery is a 50-50 and you're going to be crippled at the end of surgery and such. But that's it. Gone are those days, and there's been a lot of exciting advances in the care of our patients with spinal cord and spinal column injury or pathology, because your spinal column is not just with trauma where you have your accidents, you also have those that are related to tumor, where especially as we get older, a lot of us are having our tumors, especially our male populations, your prostate cancers, your females, you have your breast cancers, and these cancers can and do spread, and the spine is one of the commonest locations where they spread to. And there are some times where we can't cure you, but we can ensure that you have a good quality of life, which is what is important. The other thing with spine, that is the large volume of a spine, is what we call degenerative pathology. This is where you call, quote unquote, the arthritis of the spine. So as we get older, our spine, we undergo degenerative changes, and we do have degenerative pathology. This is where you have your dreaded pinched nerve, and you, as everybody, and they have the back aches, back pains, And the aim here as a spine surgeon is not just for surgery. When you
Right.
speak with a spine specialist, it's all about one, you're getting a diagnosis and you're getting a treatment plan as a part of a holistic team where it's not just to see you to operate on you, to see
Yes.
you, to improve your quality of life. And if you do need surgery, there's been lots of advances in the realm of surgery and spine surgery where the chances of spinal cord injury is for the most part is less than 1% chance of injury. So it is not a 50-50. It is highly unlikely that you will have an injury. And two, your quality of life, the aim is to get you better and to get you improved, to improve your quality of life, because it makes no sense living in significant pain because of fear. Okay.
Right. Okay.
Yeah,
Very good.
I'd like to add to that very important thing that you brought up
Yes.
was that it's a team approach. I think having Dr. Bogle with us is a great addition to our team with Dr. Larson and Dr. Shaker and all of us. So we're kind of creating this orthopedic team where we are managing everything from joint replacements, hips and knees and shoulders to now spine as well. So having Dr. Bogle is so important because a lot of patients that I treat for hip replacements or hip issues are also having spine issues that are associated with it, and commonly most patients would require a more holistic approach. And so when you have the different specialties, and we have added on, I think, important specialty of spine now, and that makes us give a more complete treatment to the patient.
Yes, so very comprehensive options with all of the surgical team members and then the support from
we
physio
do
and so
rounds
forth.
together. We work as one department. So
Yes.
so when you're on the ward, you will often see all of us coming together to discuss your case, to make sure that everything, and we give each other inputs as well, and that helps in a better overall care for the patient.
Wonderful. Well, Dr. Almeida, thank you for that additional information. So let's go ahead and introduce you to our audience as well. Okay, so we're here with Dr. Almeida, who's also part of the orthopedic team at Health Services Authority. You're one of the newest members as well?
Yes.
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 Tell us a little bit about your background.
Yeah. So I'm Dr. Alvin Almeida. I'm an orthopedic surgeon, and I did my training back in India, St. John's Medical College, and then I did my fellowships in joint replacements and arthroscopy and sports traumatology as well. And since I have about 22 years of orthopedic experience, and I've specialized into joint replacements and arthroscopic surgeries. I do hip and knee replacements, as well as arthroscopic surgeries of the knee and ligament reconstructions, and also I do a large part of my work has involved shoulder treatments and shoulder replacements as well, and including arthroscopic and rotator cuff repairs and surgeries for instability of the shoulder as well. Back in India, I was working at an orthopedic hospital that was exclusively orthopedic, and we used to do about 50-60 surgeries a day. So we had a high volume center, and that's where I did most of my spent most of my time experience, and that's why we are a little bit more versatile with regard to the number of surgeries and options that we can provide.
Wow, that's quite a number of patients, huh?
Yeah.
Yes.
Used to, it was quite an intense phase of
Yes.
this, but it was good experience, and ever since I have been in Cayman for about 10 and close to 9 years now, and
Wow, it's been that long.
we have
Yes.
been, and I've been in the Cayman community for some time as well. So, and now with me joining HSA, I'm looking at the future, and it is looking very bright. And I have a great team that I have joined, that Dr. Larson, Dr. Shaker have been here for some time, and Dr. Bogle and me are the new additions to this orthopedic team. And we are, as a team, we cover a wide range of specialties, right from hand surgery and foot and ankle, which Dr. Larson generally does, and also he does knee arthroscopies and sports traumatology. I do sports traumatology, knee arthroscopies, and shoulders, as well as I cover the reconstruction, adult reconstructive surgery, that is hip replacements, knee replacements, shoulder replacements. And we have Dr. Bogle, who does some primary hip and knee replacements as well, and is mostly a spine surgeon too. So we have a wide range of specialties that we cover comprehensively between the four of us. And in addition to providing trauma services, and as you know, HSA is the primary trauma center for any accidents, anything happens, we are the first ones to get the patients in. And we have a very comprehensive accident and emergency department and a lot of physicians there. And we work closely with them to manage trauma patients as well.
Very good. All right, so let's talk a bit about the area of sports medicine. So you've had, a real wealth of experience in a number of areas, but I understand sports medicine is of particular interest to you. It's your specialty also.
Yeah.
So tell us a little bit about, what types of patients you're seeing under that umbrella.
Sure. So sports traumatology is a wide field, because you have so many different sports, and you can see that the Cayman population, there's a lot of sports that happen. There are lots of leagues. There's the football league, and then there's a flag football, and then there's rugby, and then there's softball and baseball. And I think we are a very vibrant sporting community, to be honest. And we do see injuries from time to time, and like you mentioned a little while ago, pickleball, that's the new thing, because now a lot of the weekend warriors are suddenly jumping and lunging and then having tender Achilles tears or having some particular meniscus issues or injuries. So we are here to help the patients with these injuries get back to sports. I mean, not that we don't want we want you to start get back and return to these sports as well. So yeah, sports surgery, sports medicine, basically. We have a extensive sports medicine department. This is a room we are in as the sports medicine clinic at the HSA. And we have sports medicine physicians who can help you with the diet and medical part of sports medicine. And then we have Dr. Larson and myself, who specialize in sports traumatology. So we generally come in when you have had a ligament injury, something torn in your knee or your shoulder. And then we come in to do the job. But there's a large part of sports medicine which is medicine related, as in it would involve injections. Sometimes we can do cortisone injections. We could do PRP or platelet-rich plasma injections. We can do gel injections to the joints to help with degeneration and all that. So sports, there is a wide range, and depending on what sports you play, like for example, some sports you're more prone to have shoulder injuries or upper limb issues, and there are some sports where like football, where you would most commonly have an ACL tear or a meniscus tear in your knee. So we do have the specialization to take care of these injuries, right from medical management to surgical management.
Wow. So you pretty much got it all covered there, I would say.
Yes, pretty much. Between the shoulder and between Larson and me and Dr. Bogle, I think we have everything from the spine to the large joints covered, and even the small hands and the feet as well.
Right. So sports and exercise medicine is different how from general orthopedics?
Sports and exercise medicine would involve, some of them would involve diet advice, would involve exercise therapy and physiotherapy involvement to sometimes in pro athletes to prevent injuries, and then identify sometimes injuries early enough and intervene before it gets worse to a point where you require a surgery. So sports and exercise medicine involves a combination of physiotherapy, sports medicine specialists, and the sports traumatologist, which is the surgeons who do the surgery when something is structurally wrong. But a lot of times sports is also about things that are not necessarily structurally gone and can be improved. Say you have a rotator cuff tendinitis or a biceps tendinitis from overuse, you could do an injection or PRP to help reduce the inflammation, and then you would be given a rehab, and physiotherapists would then rehab you to work with you to get you back to full. And a lot of things in our body is biomechanics. I think orthopedics is one branch of medicine that deals more with biomechanics than anything else. So if it's your hip is off, you have a deformity, you have a bow leg, you have a knock knee, everything has an effect on how you walk in this one. So a lot of things that treatment do focus on correcting those biomechanics, and that's where the therapists and the sports medicine comes in.
Yep, absolutely. I've experienced that myself. So very good. Now tell us how people can find out more about the Sports and Exercise Medicine Clinic. What are the hours, and how can they go about booking appointments?
Yeah, so Sports and Exercise Medicine, we run from Monday to Thursday as of now, and Dr. Larson is available on Monday and Tuesdays, and I do Wednesdays and Thursdays. And we have sports medicine physicians as well in the same complex. So we kind of collaborate and coordinate with each other when it comes to treatment of patients.
And you're located
and it's
here.
located in Smith Road Center.
Yes.
It's the number is 244-7739.
Yes.
That's the number for the sports clinic, and also you could call the HSA number to our appointment desk as well to get appointments here.
And the general telephone number being 949-8600. And you can ask specifically for the Sports and Exercise Medicine Clinic.
Yes.
And they'll book appointments for you.
Sure.
Okay, beautiful. Well, thank you so much, Dr. Almeida, and welcome to the HSA team.
Thank you.
All righty.
Pleasure.